Assalamu alaikum wa rahmatullahi wa barakatuh. Good morning, my students. Today we'll be starting the previous lectures, and I spoke before about the impression material. By the way, the impression material, if you remember, I classified according to the reversible and irreversible. And if you remember, it's used some of them in undercuts is rubber like, or you cannot use it or no have any elasticity of this material that cannot be used in undercut. And one of the example that you cannot use it if the patient have undercuts, if you remember, the what zinc oxide ethenols. The zinc oxide ethanol material, if you remember, you have two tubes. These two tubes is coming, and you can mix it together to get the homogeneous paste until you can put it on the special tray that you fabricated to put it in the patient mouth. But for remember, you no undercuts. If you have any damaging of these impressions, you can put, if you have any bubbles, if you can have any, because the thick saliva, for example, you can cover these bubbles or depressions by the wax. Okay, another elastomeric material is used more commonly used nowadays is for using clinically for a bridge, implant, partial dentures, complete denture, indirect aesthetic restorations. And these material, elastomers materials, already you have a polysulfides, you have silicone rubber that's used more common now, okay, silicone rubber additional cure types, and polyethers. And the rubber, silicone rubber, really you have to do different types, A and C. You can using for according to the accuracy that you use it for. Okay, so from this point, I have a range of variety of material that I can use it for the best selections of the patients. If you good diagnosis of the patient, you get, or you can select a good impressions material. Finally, for remember you also, I not do any passing any steps, and I say I will fix it in the next. No, I should be prepared in good way each steps. Otherwise, I lost the next steps too, and final denture will be destroyed too. Okay, so each steps I should be make it according to the instructions, and I follow the next according to the next until I get the final good dentures. From this point of view, I go to another material, polysulfides. If I look to the picture, I see it is coming to the toothpaste tube, right? And you have pad for mixings, and also the same that zinc oxide ethenols that available for you is you have also, it's a catalyst and what base. So the catalyst and the base. So if you make it with the, according to the instructions, you will have a specific working time. But if you need to increasing the working time, should be what? Decreasing the catalyst. If you make short working time, okay, you can what? You can add more catalyst to a base to get more fasting results. According to the time, what I mean, according to the weather that you have in the cold or hot, in the summer or winters, okay, you can select the material or the mixing ratio between the two. Return back to the slides. These materials are generally supplied as a two paste, which are dispensed from tubes, one paste in normal label base and another labeled catalyst. Setting time of 10 minutes or more, particularly for the high-bodied materials. For the polysulfate elastomer have a very good tearing resistance. Look, for this reasons, if you have a good tearing resistance, so it's you can, for example, if you have undercut or like this, you can use it. So you can, one of the option if the patient have undercuts, has unpleasant odors, It's already, you cannot be adding some materials to that for get a good odor for patients. And the color contrast between the two paste is should be give you a sign, or give you the sign to know how much you mixed. For example, the two paste is differ in the colors too much. If I look now to the pictures, I see is one also browns, one white. So it's a big contrast between the two. So during the mixings, you can see if you have unmixed materials. And of course, should be homogeneous in color, no strict to achieving a good results in the futures. Look, what is the difference if you not, I make it not homogeneous one mixings. The setting area, some of material will be set, some of material not be set, another material may be delay in settings because the mixing to the catalyst will be affecting the working time. By this way, during I remove it from the patient mouth, I get some area set, another area is sticked, another area maybe is not settings at all. For these reasons, I should be check the mixings, okay? And then when I loaded my special tray, I should be in good and homogeneous way to get all together the setting time in good, uh, dimensional change. Look, in addition to the not homogeneous, if you not mixed in good way, also you can affecting the dimensional change. Okay, so if you're mixing according to instructions, you get a full properties of these materials physically and chemically. For an adhesive is used to promote the adhesions between the impression material and the tray, because you have not sticked material. You should be used adhesive with these materials. The adhesives is coming with the small bottles. You can adding to the a special tray on the base, okay, according to the instruction of material. After that, I loaded my material on the tray and then I push it in the patient mouth. I think until now no have a problems with these materials, but take care which material with the undercut, with material is not. In some types of equation, maybe you can come to you if the patient have undercut, or picture of patient with the undercuts. Okay, so which material that you prefer to use it, and explain the properties of these materials. You will go to select one of the material, can use it for the undercuts, and explain or simple discussion or essay about these materials. If I go to another, is the clinical considerations when you use with the custom tray, of course, or always 2 mm thickness. What? The thickening that they mean the distance between, or the space between the special tray and what? The soft tissue and the hard tissue that need to register. And this is, you can control it through the what? Your special tray. By the way, how I can controlling the special tray is away from what? My hard or soft tissue that I need to record. Now, I think most of you, you did it, right? You did it, the special tray in the lab. So the clinical consideration when you use with the custom tray, always I allow 2 mm thickness between the thickness of the material to work properly. Settings times is 10 minutes. Use the tray adhesives, have very good tearing resistance. So this is I should be put it in my mind before I'm using these materials. Okay, so I going to most common type of material that use it, and maybe you see with your friends in the fourth and fifth grades with the patients, is a silicone rubber material. The condensations of these silicones is developed as alternative to polysulfates, because you know the odors of these materials have more desirable qualities in a comparison, because to the cell polysulfates is easy mixed, better taste and odor, okay, less, shorter settings time between 5 to 7 millimeters. Then this material is coming to overcome the problems that you have in the polysulfate materials. The proportions of the paste liquid material is by mixing a given volume of the paste with a fixed number of drops of the liquids. So for a paste material, equal length of the paste are mixed. Look, these materials is coming by two forms. The form of these materials, or the shape of these materials, or the package of these materials, coming either by the paste to the liquids or paste. Okay, almost these rubber materials nowadays, you have a heavy body and the light body. The heavy body, the common name of these materials, is coming by the two jar of the material, and you can mix it by the same quantity for this one and this one, paste and catalyst. So I take the same from here, spoon from here, spoon from here, mix it together to get the final settings of the final materials. For the light body material, almost coming by either by paste to liquids shapes or to paste, and then I mix it with the same amount to get a final results. Okay, inshallah. Now the next picture I show you how it's coming, and most of the now the light body is coming with the gun. It's too easy to mix, not depending on the mixings of you. So what is two gun or two tubes mixed together, used with the guns, and you have mixing step. The mixing, when you're pushing the material, the two paste and catalysts go together, mixing together, and get you final results without any depending on you how much you put from catalyst or the paste. So a color, a contrast between the paste enable you to know if you have achieved final mixings, or you should be stopped, or you should be continue to mix until you get a homogeneous color. In order to obtain optimal accuracy, the model should be cast as soon as possible after recording the impressions. One of the disadvantage of these, the disadvantage of material should be noted, because now if you look into the clinics and take impressions by the alginates, for example, the alginate have the ability to absorb the humidity from the outside. So maybe the final results of you for impression of the patients, you can see it is increasing in the size due to absorbed of the water from outside. So, or if you have in the summertime, you take impressions after a day, you come to the impression, you see it's dry, it's a fracture like, it's not have rubbery. You lost the water by vibrations, and due to the humidity is not too low. I mean, the water is go out from your impressions to outside, and let the final impression that you have is like is a fractured, is tough materials. So you should be take care about the time of the pouring with the stones. And I for you, I give you one note that you should be, if you have a time, directly pour any material that use it, don't depending on the properties of these materials, because the difference in the dimension, even in a half or at 20 or more, for example, it's a part of millimeters, is affecting on your retention of these dentures. Take care about these things, because the dimension change is important, will be destroy your work, okay? And finally, you lost your job by a simple mistakes like the time for pouring of these materials. The additional silicone that I said for you, the light body, you can see the gun, you can see the tubes that fix it on the guns, you can see here the mixings, here the mixing tips, okay? And you can more accurate material, because you use it after a heavy body or the rubber-based materials. Is a desirable clinical qualities, dimensional stables, accuracy, clean, easy to mix, no full odors or stains. However, there are among the most expensive This is one of the disadvantage, because he's used technology for mixing, so packaging, so like this. Any material nowadays, if you go to buy it and give you some facility to decrease your time, of course you have little bit, the price is higher than that using a traditional methods for mixings. The proportions is carried out by the extruded equal length of each based on the mixing pad, a good or color contrast, the same that you have it to achieve the same results. The standard disinfections regime of for 10 minutes immersions of sodium hypochlorite will have no effect on the dimension stability of these materials. This is the same. Look, some of you, maybe you need to not spend a material during the mixings. What I mean, during the using of these mixing steps, you see, you have a material staying on these mixing steps. You lost this material, okay, finally, because you cannot stop the material from stopped from the tubes until you go out all the material in these mixing tips. From this point, they have some material staying on these mixing steps. Due to the times using for 2, 3, 4, 5 patients, you have a large amount, you lost it through these tubes. By this way, you can maybe you to decreasing your cost, okay? I can using the same gun, the same material, but I remove the mixing steps, then I pushing these materials on the pad, okay, and then I mix it by a spatula or anything that I needed, or a spoons, or for example a spatula or any mixing material, like you can using the end of the mirrors, okay, to mixing so that you have it. And during this you can saving the material that you lost during this the remaining of the material in the this mixing tips. From this point of view, the additional materials, the rubber based material, the silicone, is came by two types, the A and C. A is used for more accuracy for the, for example, veneer that you hear about it, Hollywood smile, okay. You can use it for the bridge and the crown and the bridge, that more accuracy. If you need the impression for just occlusion, for example, or bite registrations, you can use a type C. Is less expensive, it's cheaper, but the dimension stability of this material is less than A. So I can use it for more the material that, for example, bridge crowns, the opposing teeth, to record the opposing teeth. So I not needed to more accuracy. It's just for occlusion. So I can use rubber type C. For A, I can use for more accuracy, for accurate cases, that the bridge crowns, for veneer, luminaire, for anything to register more accurate, and depending on the dimension and stability of these materials. Polyether materials also is using for crown and the bridge walking, since they are very accurate, and also more hydrophilic material. You know, the hydrophilic and hydrophobic, what is meanings? When phobic is meaning he is afraid from the water, he's go away from the waters, and hydrophilic, that you take the water or you accept it. So some of them, some of these materials, if you use it with the humidity, saliva, okay, maybe not registered this area because he's phobic from the water and saliva. So he's good this area in good. You reach this point again. Some of the material, according to the chemical, I think you took it in the dental material, or we take it, hydrophobic or hydrophilic. The philic is meaning he's accept the water. He's not afraid from the water. You can go and register any area, even have a water or saliva or anything that you can available on it, the patient mouth. But hydrophobic, you should be go and dry all the area, because this material will be go away from the water, not can be mixed with the water, or cannot be pushing the saliva away. So by this way, not registered anything. If you have any saliva touching to you, you should be go to clean it again and take impression again, because it's not registered this area that you have. The two pastes are proportions by the volumes. If you see it on the part 2, you can see you have two sizes. Almost the catalyst is coming with the small, okay, with the small tubes, and the big tubes with the catalyst that you have. Equal length of paste are extruded on the mixing pad, giving a paste catalyst volume ratio about 8 to 1. Look how the ratio is more. It's almost the same length, but not in the same length. Yes, but yes, in the same length, I mean, but different in diameter. If you see now the paste you have in the pictures, you have two different diameters. One is so small, this is the catalyst, and the largest one is the paste. And the catalyst now is the same length, but different in diameters. Okay? So a good color contrasts between the paste, in mixings, and you be sure mixing good quality finally. Very good dimension stability. A standard disinfection routine is for 10 minutes immersed in sodium hypochlorite is unlikely to have any deteriorations of the effect or affecting on the accuracy of this material. So the polyether material is like the silicone, but here you can come by one mixings or two tubes, I mean by one shapes, not two shape. And for accuracy, almost you can use it, or you can zinc oxide eugenol. I, in my clinic, use zinc oxide eugenol for cases no have undercuts. Is more efficient and mostly used nowadays. But take care some of the clinical considerations. The patient that you have sensitivity, take care about it. Maybe have allergic reactions. This is the first point. The second point, when you are starting to take, before I'm starting to take the impression, especially with the material that you have sticked, like zinc oxide eugenol, I put a Vaseline on the lips, okay? Take care, because this material will be sticked on the patients. Yani what I mean, patient coming to you, you have, for example, sensitive lips, okay? You have some hair. This material will be high sticked materials. So I should be put a Vaselines on this material that I maybe to prevent any sticking of this material, or to make easy cleaning of this material after if I'm touching or extra hair on the corner of the mouth. Okay, so I put Vaselines before I take these impressions, and then take care for these impressions to not touch anything things outside. And then when you put it inside, it's no problem after that, because it's easy to clean it. Okay, and cleaning your mixture, for example, a spatula, what you have, cleaning well, because this material high sticked material. Maybe you destroy your for example, the mixing spot. If you're using glass, should be cleaning well and after mixing directly. The properties of this material is stiff, difficult to remove from the undercuts, short working and setting times. The setting times is about 3 to 5 minutes, and it's of course is more accurate of these materials. So take care. This is like zinc oxide eugenol. It's not used in the undercut cases, but the working time is very nice, because the 3 to 5 minutes is good for patient have a gang reflex, for example, and you're not affecting by the water, because sometimes if the patient have a gang reflex and moving more saliva toward the oral cavity during the insertions of your impressions, affecting the quality of these materials after that. Okay, because you have many bubbles if the material is hydrophobic. Okay, so from this point, you should be take care about the material types. Now is important subjects. One of the important subjects is the final impression techniques. You have different techniques you can use it, and each techniques you have advantage and disadvantage. Of course, from this point of view, I can finding the select the material and the technique that is suitable for these patients to get a final results. Okay, so the final impressions, the mucodynamic technique. What is meaning? It's also referred as a closed mouth technique. Okay, so what is meaning a closed? Now I can show you how is it and how the technique is working. They're recording the tissue in their functional positions. Okay, so the patient apply pressure by closing against the occlusal rim or the teeth. The patient exert the pressures or extrude the muscles actions. Okay, so how is this technique is doing? After I put these materials inside the patient's mouth, okay, if the patient, for example, have opposing teeth, I have single dentures, I can need to take it the just for upper, okay, or I have the upper and the lower complete dentures, and I have occlusal rim. Occlusal rim, what's meanings? Occlusal rim, after this steps, you take impressions, final impressions, you will fabricate the occlusal rims. Maybe you will now I think maybe you reach this point or not. The wax, instead of the alveolar ridge, you have a slice of the wax. This wax area representing the alveolar ridge, that you residual ridge that you have, and then you put the teeth on it, the plastic teeth or acrylic teeth that you put it on this occlusal rim. So this occlusal rim is representing now the bone, the alveolar bone or residual ridge after extraction of teeth. Okay, and during that you take the impressions in the patient's mouth, you ask the patient to close. Okay, so when he closing, he's apply the pressures to the what, to your impressions. Okay, and by this way you can remove your hands. Sorry, you can removing your hands, and the patient he is pressed on the impressions. Tray. Sorry again. By this way, the patient exert force without any due force. And then when you get the material sets, ask the patient to open his mouth and remove the special device. Of course, this techniques nowadays is not used too much. Most of the technique that use it now mucostatic, because you have many disadvantages. Of course, he's a displaced soft tissue because the patient put a force by himself or herself. He is allowed the soft tissue to go away, displaced tissues. By this displaced tissues, his unseated denture space, the final results. So what happens? The pressure limiting on the normal blood supply go to what causing resorptions. Look, now all the dentures exert force to the what? To the residual ridge. And if you see the patients after a time and check the quality of the bone that you have it, already if have a severe pressures on the alveolar ridge is causing the resorptions. You can finding after a time the resorptions of the bone and decreasing the thickness of the residual ridge. And some of the cases is coming to the clinics, even if you look to the CBCTs or the sections of the face of the arch, I can see nothing's bone thickness is about 0.5, is a half millim. And almost normally for a patients, maybe you can see 13, 15, 16, 17 millim. And now is 0.5, half millim away from the sinus, for example, or the nerve of the lowers. So during these pressures, what's causing? Because what is the cause of these resorptions? Of course, during these pressures will be causing limiting blood supply to these areas, causing resorptions. And of course, the patient not exert or give the force to all the area in equal way. because you have many factors. The thickness of the lowers of the alveolar residual ridge, is not the same on the same levels. One. The second, the patient differ due to the muscles actions, right? So the muscles of the patient, some of patients have very hard muscles or strong muscles or spasms muscles, another have a soft. So the pressure from patient to patient differ, not like you, because you can observe or you can give a force by equal way for all the patient, that because you have a standing forces by your hands to the impression tray. But here the patient depend on your patients. Maybe anterior force differ from posterior, or maybe side differ from sides. So the quality of the displacement of the tissues, okay, it's not the same on the all area. By this way, the unsetting of the denture base, maybe you get the final results of your dentures. Normally, why the displaced tissue affecting the base? Because when you normally put the dentures, you don't have any displacement of the tissue. So you record now the recording of these tissues now is not on the normal situations. You recorded under pressures. And these under pressures, you should be setting this base or denture base, on also by pressures areas. Okay, so it's not normal way. By this way, when you put the denture with a normal way, you get maybe have problems or trauma to what, to the soft tissues, because already you have a pressures by this area and you record it by wrong way. And don't forget the thickness of a mucosa also during the pressure will be different. So when you're doing the insertion with the normal without any forces, you will not register the tissues with this form. Okay, you registered during the pressures. So this denture will be working under pressures. Without the pressures, is not working or displaced outside, because you're not recording the soft tissue in good way. So you should be you can use these techniques. You can ask the patient to underpress more. Okay, try to be equalizing the pressures from the right and the left, anterior, posterior, to not get unsetting dentures or resorptions of the alveolar bridge. The mucostatic techniques, always that you're referring the open mouth technique that you take now, or you know it, or you saw, or you will see it with your friends in the 4th and 5th grades. Recording the tissues in their displaced positions, you're recording by your hands. The dentist exerts pressure, and the space spatial tray with no border seals. The space specials, the space you should have a space of the material that you needed, and no border seals should be taken. The borders, if you remember, the special trays should be fabricated away from your sulcus. Is not 100 touch to the sulcus depth. Low. Why? Because you should be put the space for the final impression to recording the final shapes of your depth or your extensions of the flange of your dentures. Good? Because if you are now pushing your hands between your lips or cheeks and the buccal wall of residual ridge or your alveolar ridge that you have it, you can pushing. So you have some forces, you can pushing down and up. And don't forget the action of the muscles. The muscles of the cheeks, muscle of mastications. These muscles have the ability to decreasing the sulcus, okay, or the depth of the flange from area to area. So during this recording, you should be taking in your mind this extensions area, because if your denture have a large, long flange extended to this depth, okay, or determining how much the depth of your sulcus, that you can see affecting the denture in future, because in patient during any mastication force will be lost the dentures. The space special trace with no border seals, closed adaptations of the denture base to the undestroyed mucosa because the thickness is the same, so you not destroy anything. The border seals, of course, sometime if you not registered in good way, you will decreasing from your retentions. But this techniques is very good and you can use it, but take care about the point of movements. So during I take the impressions, I move the muscles from this area and be sure you loading a good amount of material on the special tray because maybe you put it on the not in good quantity. Okay, so you have some deficiency in some area. Put it in your mind. You have a space of a special tray, okay, and of course in the borders, and you should be call these materials to these areas to recording in good way. Put it in your mind. So the problem of sealing borders, you can bypass it by good passing of material and good technique of registration, better than the closed mouth technique. Okay, so the open mouth technique is better for you to take these impressions. If I go to the another, is selective pressure technique. This technique, you can mix between the pressure one or the closed techniques and open techniques, but this is modifying for pressure one by making or trying to make the pressure in all area with the same. The extension of the maximum coverage within the tissue's tolerance, the light pressures or intimate contact with the movable loose and attachment tissue, especially in the vestibules that you have it, and minimum pressure. The impression compound tray or zinc oxide engineered paste, you can use it, a special tray with the borders refibrous. This is techniques you can use it to select the pressures according to the area that you like it. Look, by this way, you can put, not allow the patient to press, okay, or your hand to press. You can select a difference in the area. You can see the patient where area need to pressures, where area need not good, يعني no have a pressure on it. So by this way, you can controlling little bit the displacement of the tissues and overcome the problem of closing of the patients or the pressures of the patients. I put this for you for pouring of the cast. This is pictures referring to you or giving to you the informations of how you can pour the impressions of you after that with the what, with the stones or any material that you need. Look, normally during the mixings, take care from the what, from the bubbles. The air bubbles can come to incubate inside that two mixings aeration, okay, especially if you put a material differ, for example the waters and the powders of the plasters, for example, all the stones. Some of you using the waters too much or using the adding of the powders or are using the stones or the plasters, or sometimes you should be mixing. You have the water and then you put the powder on it, not the powder and then put the water on side, because each technique have the amount of air you can enter through during the mixings, and these air bubbles will be destroy your work, because if you coming during the pouring of your special tray with this your stones and you have the bubbles inside, already this bubble become to touching to your surface area that you needed, the final denture surface area. By this way, when you get the stones, you have some missing part due to these air bubbles not allow the material to reach all the surfaces area. By this material, by this problem, sorry, you can use either your hands, okay, inshallah in the lab you will be use it, either by using a small pressure on your, with your special trace, after put a small amount of the plaster or stones Now you have a special stage, a special tray should be with the stone, final impressions. With the stone until you're touching and removing the bubbles on it. Or you can use a what? Vibrator. The device here, you have the device available in your lab, this vibrator. This vibrator, after add a small amount of the stone and then put it on this device, the the vibrator working and removing all the bubbles from the base or from the surface tissues areas to outsides and to sure that it's clear. I have another techniques. I said to you how I use it. I mix the stones with a little bit flowable, not on the creamy way. And then I put it on all the surfaces area, okay, of your tray. Then I checked the bubbles if it's available or now it's more a little bit flowable. Now he's going to enter to all undercuts and areas. By thin layer, I can check the bubbles if it's available or not. By this way, okay, now I checked all the surfaces area is touching with the stones. I can make it opposite of the tray and removing excess of the stones. Now what I have is small layer or very thin layer of the stone on all the special tray. Then I increase the thickness of the stones and then I again add it to these small layers or very thin layers of stones to the tray, and I am sure that all the surface or touching surfaces that available on the special tray now is covered with the stones. I'm not afraid more from the bubbles because I check it from the first steps without need to return back to the first steps. If you have available of the teeth, the problem here, I can use the same methods that I explained to you by thin layers and check the bubbles by probe, and then I put with the stones. Be sure no have any stones, no have any bubbles in the stones. Perfect cast, you can get it. So the pouring of the cast is composed of the two parts, which are prepared separately. Anatomical part, hard and soft tissues, impressions, poured using vibrators, and the art proportion of the base, which is important to aid the handlings, and the articulator, the cast, can be poured with the different ways. So after I get the final results of the two casts, I should be also have articulator to fix it on it to be get a final results. Look, when I finished the double port methods, when I finished the impressions, I should be make to the base to be easy to handlings, one, and for easy not to be sure not to fractures. So I should be have what I have a base. Now I can make a base from different material that I'm not that pouring from the first tray. What I mean, يعني I have a special tray. I should be poured with the stones because have a large. I need a strong cast. Okay, by this way, I can put the base from the plaster. So after starting the hardening of this material of the what of the stones, I can make a base from the plasters, and I can see here is two different colors and two different materials. I can base with the plasters instead of the stone because the stone almost expensive. Okay, and why I make it on the base? So I have should be make it on the base too easy to control the cast, not be sure the fracture during removing from the tray because especially the lower cast is become too thin, maybe fractured. Okay, and you can easily to put it on the articulators after that to starting to arranging the teeth. By this way is nowadays is good, and I can make it now the cast I get it from the stones, the base I can make it from the plasters. The technique that I use it is a good way to take impressions, and finally I get a good impressions to get a final results. And all these steps, if I not make the impression in good way, I lost these all steps. From this point of view, the single steps, the both anatomical and art portions of the cast are prepared at the same times. This method requires skill and accurate time. Is difficult to be encountered if the mixing is too running, if the mixing start to initial says. Look, you have two problems of these single techniques. What he meaning single techniques? I make it with the base, I pour the stones on the tray, then directly I put in the base. So you should be control the mixing ratio, settings times, okay, initial sets, or you can destroy your work. Why? Because maybe you put a stone and then I put the plasters on the base. The plasters is go to take the water from the stone and make the stone is too material loss of the water, so make it the stone too rough surface. The final results of the surface is too rough because they lost the water by the plasters. And if you make it running material, you have not good thickness. Maybe the thickening of the plaster is more pushing away the stones material from the special tray, and the plaster coming to invite or inside is become to invaded inside the tray and become part of the special tray, special stones or the final results of the stone space. And this is not you planning to, because you need a material, hard material to construct, because finally you should be make the base of the dentures by the acrylic, and you should be put it on the hot waters, and maybe the plaster cannot be withstanding these high temperatures. By this way, the single techniques is a little bit difficult. I used as two steps is easy. You can start into initial settings. You be sure the first stage I can make the base by the what, by the plasters and so on. So from this point of view, I can get a final result with the a base with a different material if you need to survive or to saving some monies. جيت اخذت امبريشن، راح الامبريشن ماتيريال مالي different type of impression عندي according مثلا عندك patient عنده اندر كاتس، ما عنده اندر كاتس، راح تريد السيتنجز تايم مالتك، طبعا اكيد البرايس مال الماتيريالز، ميبي انت هسه تشتغل بالكليه تشتغل بالبرايس لو، تجيب لك ماتيريال ميبي لو برايسز، بس بالمقابل مثلا الاوردر مالته ما طيب، مثلا الريحه مالته ما طيبه، الاوردر التيست مالته ما طيب، بس تعوضك عن السعر. ممكن الاكيورسي تحصلها من عده نوعيات من الماتيريال. فاينلي انت عندك ماتيريال فور اندر كاتس، ماتيريال فور نون اندر كاتس، اوكي، وماتيريال يو كان راسا تروح وتصبها بالستونز، وماتيريال ما يصير عندك لازم عادي، يعني اذا ممكن تتركها بلا ما يصير عندك دايمنشنال تشينج. دائما الماتيريال راح تجيك بكاتاليست وبيست ديفرنت شيب، راح تجيك مش يعني اشكال مختلفه، ممكن تو بيست، ممكن تجيك بدوجار مثل الربر بيس، واكوردنج تو ذا ميكسينج ريشيو اللي موجوده عندك موجود انستركشن مال الماتيريال. طبعا عاده الكاتاليست والبيس يجوك معاها ميكسينج باد، هذه الورقه اللي تخلط بيها، فيجوك مرسوم اللينث، مرسوم عليها لايت كاتاليست وبيست، فتخلط حتى تحصل على كونستانت كلر، وترجع تعمل لودينج للتري. دير بالك من شيء اسمه تايم مال وركينج تايم. وركينج تايم مهم، ليش؟ لانه انا بالنسبه لي ممكن بيشن عندي جانج ريفلكس، فانا ممكن انه اخسر اللودينجز مالتي مال الامبريشن من البيشنت، تخلي الامبريشن بيشن ماوث راح يصير جانج ريفلكس. المشكله بالجانج ريفلكس عندك عده مشاكل، ممكن البيشنت تخليه يتحمل، بس المشكله هذا يصير جانج ريفلكس راح يحرك لك البوستيريور بارت مال البلت والسوفت بلت، كله هذا راح يتحرك عندك. من يتحرك عندك الريجستريشن مال هارت بلت البوستيريور اريا ما حتكون بشكل صحيح. وما بس هاي المشكله راح تفوت لك سلايفا، زين، لانه السلايفا راح تزداد عنده، فراح يفوت لك السلايفا منخلف من تحت الامبريشن، فالاريا الامبريشن الماتيريال مالتك اذا كانت ما لها قابليه على انه تدفع هذا الووتر من نوعيه الفوبيك اللي هي تخاف من الووتر، فراح تضطر يصير عندك هوني بابلز. ان شاء الله من تاخذون امبريشن راح تصير عندكم، مرات تظهر عندكم اذا تشوفوا بعض الكيسات، خاصه بالمنطقه الاخيره اليم السوفت بلت، فتشوف مناطق راحت من الماتيريال وكان صارت مثل المناطق بقع انه هي وين كان صار بها اير بابلز. طبعا انا اطيق بالامبريشن واكس، اطيق اسده بواكس عادي وهذه، بس طبعا الاكيورسي مالتها راح تختلف لانه انت راح تحطها راندملي، يعني مع الادجيسنت راح تساويها، بس ممكن هاي مكان هي مرتفعه بالاصل، ممكن هي منخفضه. اوكي، راح ارجع استخدم التكنيك. هسه استخدمت الماتيريال اللي تناسبني. التكنيك مال الامبريشن عندي كلوز ماوث، عندي اوبن ماوث، عندي ميوكودايناميك، وعندي الميوكوستاتكس، وعندي سيلكتيف بريشرز. اوكي، واحده منهم اللي هي عندك الكلوز تكنيكس اللي هو البيشنت بريست اللي ميوكودايناميك، هذا راح تخلي المريض هو يسد. فممكن عنده تيث ممكن تعمل له سنجل دينشر، ممكن ابر، ممكن لور. اوكي، ممكن تخلي البيشنت هو يسد على السبيشال تري مالتك بعد ما كنت حطيت عليها الماتيريال. بس المشكله انه المريض راح يسد عنده ممكن مكان عنده تيث، مكان ما عنده تيث. ممكن البيشنت عنده كومبليت دنشر هو بالاصل يعني جايك. اوكي، فتخليه بدنشر من الدناشر ثم وتخليه يسد اوكي على الامبريشن مال الابر، واللور العكس عنده دنشر هو قديم بالاصل، مثلا تاخذ امبريشن للور يسد عليها بالتيث او الدنشر مالته القديم بالابر. بهاي الطريقه المشكله عندك راح اسلط البريشر يعني ما بشكل متوازي، يعني اسباب كثيره. ممكن الريتش مالتك ما يعني سوفان مال الريتش مالتك ما تكون ايكوال، هاي واحد. الاكشن مال المصل، يكون البيشن مالتك التيث اللي عنده ما بنفس الليفل، فايريا راح يصير بيها بريشر عالي وايريا راح يصير بريشر قليل. فالبريشر عالي راح يدفع التشو بقوته، راح يدفع التشو ويحاول يحصلك على نتيجه البريشر بالقوه. بس هذا الميكوزا ثيكنس ماله راح يختلف، الديبث مالتك مال الفلنجات والفيستيبيولز كلها والسلكسات مالتك راح تختلف. اوكي، فالفيستيبيول راح يبين اعمق، الفلانج راح يبين اطول عندك بالفاينل دنشر. من تيجي تشيكه بالفاينل دنشر راح تشوف انه هو كليرش فلانج عالي ويعني عميق، وممكن ماخذ مكان السوفت تشو، واي حركه بالسوفت تشوز اريا ومسلز مال ماستيكيشن راح يسبب لك اللوست مال دنشر. من هاي المكان انا بالنسبه لي راح اشيل هذا الخط، راح استخدم الخط الثاني اللي هو الميوكوستاتيك، اللي هو انت تسلط مالتك البريشر باي يور هاندز. بهاي العمليه انا راح اسلط الضغط على ايدي بشكل متوازن، ما حدفع سوفت تشو على مهلي، زين، ما يحتاج القوه لانه انا اسجل كل شيء بشكل اللي هو الطبيعي. اللي راح يصير عندي انه البوردرز مالتي بالسبيشال تري لازم تكون شويه اندر حتى الماتيريال مال الفاينل تعبر هاي المكان الحواف البوردرز مال السبيشال تري حتى تحصل على جود فاينل ريزلتس. هذه المكانات مكان انت مرات ما تحرك المصل بشكل صحيح، او كن خليت ماتيريال قليله ممكن تفقدك البوردر سيلز مالتك اذا كان عندك ديفيشنسي بهاي المكان. زين اخوي، الطريقه نحن بعد ما خلصنا هاي العمليه راح نرجع نصبها بالستون. طريقه الصب بالستون عندك هو 2 ستيبس وعندك 1 ستيبس. طبعا انا راح استخدم جهاز اسمه الفايبريتر حتى اتخلص من الشيء اسمه بابلز. هاي البابلز اللي هي during mixing ratios ان شاء الله تاخذوها بالدنتال ماتيريال. هذه عمليه كلش سهله، انه انت مجرد انه تخلط الريشيو، مرات نحن متعلمين نحط الباودر وبعدين نخلي الووتر، هو العكس لازم ووتر وبعدين باودر حتى البابلز تطلع. زين during mixing انت راح تخلط هم بابلز يجيك اوكي، بس طبعا الووتر وبعدين تجيب الباودر هي الطريقه الاصح حتى تخلص من البابلز الموجود. خلطتها بالطريقه الغلط طلع عندك بابلز. هاي البابلز انت عندك من حتصب الكاست مالتك او راح تطلع تصب السبيشال تري بعد اخذت انه الفاينل امبريشن. هذه البابلز طخت السوفت تيشوز مالتك المنطقه اللي بيس مال الدنشر، راح يطلع عندك فراغ، فراح تتدمر، راح يصير شغلك كله صفر، راح تطلع عندك الكاست، راح يطلع عندك فراغات، ما حتحصل شيء، ترجع تصبه مره ثانيه وتفقد التايم والماتيريال، واحتمال يصير ديستورشنز للتري مالتك. فانا ارجع شو اعمل؟ راح استخدم جهاز اسمه الفايبريتر حتى يطلع لي هاي الاير بابلز اوت، والميكسينجز مالتكم ان شاء الله بالمختبر راح تخلطوها وتعلمون شلون طريقه الخلط وتستخدمون الفايبريتر. انا مرات طريقه عندي كلش حلوه مستخدمه، راح اخلط الستون شويه ثن ما كريمي، اوكي شويه ثن، فارجع ايش اعمل؟ اضيف على التري مالي، كل التري مالتي تكون عليها ثن لاير من الستون. حلو، راح اشيك اذا اكو بابلز اكو منطقه ما فات عليها لانه عاد اشوفه بعيني لانه هي ثن لاير، من الستون. بعدها راح اقلبها اوكي داخل الربر باول مالتي، وراح اشيل الاكسس مال الستون. هسه ايش ضل عندي؟ ثين لاير من الستون يغطي كل شيء، وعاد اشوفه ماكو بابلز. راح ارجع اكمل الستون مالتي، الميكسينج مالتي راح اضيف له ستون، وراح اجي اعمله شويه اثخن كريمي، وارجع اصب بقيه التري لما اصل الثخن مالتي كامل. بهالطريقه انا ضامن اول لاير ما بيها بابلز، انا شايفه بعيني اوكي، وما بيها اي ماتيريال وما بيها اي مشكله وما بيها هذه. فالماتيريال اللي بعد مجرد نعطيك الثيكنس. بعد ما خلصنا هذا الثيكنس لازم نعمل له بيس. هاي البيس اوكي، هاي البيس لازم اعملها اما انا بنفس الماتيريال مالتي، اما الستون، او اطيق اعملها بيش بالبلاستر. يعني دو ديفرنت ماتيريال. انا حصب بالقاعده مالتي ستون حتى تتحمل بريشر وهيت ان شاء الله بطريقه الكيورينج مال دنتشر بيس. وبعدها انا اطيق استخدم البيس بلاستر. البلاستر ما يهمني بعد، لانه هذا مجرد راح اقعده على ارتكليتر اوكي. فالتكنيك هذا يسمونه تو ستيبس. 1 ستيبس راح استخلط الماتيريال، بس دير بالي انا ديورينج ميكسينج عندي بلاستر عندي ستون، فالستون لازم يصيروا بدايه سيت، يلا اجيب البلاستر واعمل له بيس. والا الماي اللي البلاستر راح يجي ياخذ الماي كمين من الستون، وممكن الستون راح يصير عندك في السطح رف اوكي خشن، لانه راح ينفقد الوتر منه، راح يسحبه ابو البلاستر، او راح ياثر عندي على ايش؟ على الميكسينج. يعني مرات تكون الماتيريال مال الستون مالتي بعد ما كان صارت سيت او انيشيال سيت، وانا من اجيب بلاسترز، البلاستر راح يجر الستون لانه اثقل، راح يجر الستون ويقعد هو مكانه. بس انا ما اريد هذا، لانه انا ما اريد البلاستر يصل على منطقه اللي هي بها الرج، لانه انا بعدين راح استخدم البيس وراح استخدم الهيتر والهوت ووتر وراح يستخدمه بالكيورينج، راح يصير حراره عاليه، فممكن البلاستر يصير بينه ديستورشنز. انا ما اريده، انا اريد الستون. ولهذا لازم يعني ننتبه على السيتنج تايم مالتنا، وتجيب البيس ونصب البيس اللي هي نحن الصوره اللي وصلتكم بطريقه السنجل تكنيك، وعندك التو ستيب تكنيكس اوكي. فراح نستخدم الفايبريتر، راح نخلص منه العمليه. بعد عملنا البيس بالبلاسترز، بعدها نفتح التري وفينيشت. هسه نحن حصلنا على الفاينل ريزلتس والفاينل بوزيتيف مع البيشنتس. الاندر كات هسه انا عندي ريدج، الريدج هاك شكله اوكي. الاندر كات وين يصير؟ هسه هذا السيرفس عندي عدل تمام. زين انا اذا عندي هاكذ ايش راح يصير عندي؟ هذا الكلوزل فيو اوكي، هذا مالت الفيستبيول. ايش راح يصير عندي؟ شوف من هوني يصير عندي مسافه، وبعدين تجيني منطقه مثل خلينا نقول ما طصه اوكي، حفره، ويرجع مرتلخ يرتفع. هتشوف شلون؟ يعني مرتفع وانخفاض وارتفاع. هاي الرج، هذا الفراغ يسمونه اندر كات هاك. زين انا هسه اشني هذا الاندر كات؟ شوف ايش يصير عندي. راح اجيب التري اقعده هوني، شوف راح يصير عندي فراغ هوني كبير مكان هذا الفراغ الحفره تمام. الماتيريال مال سبيشال تري من راح تيجي تاخذ هاي المكان تسجله، من ارجع اريد اشيله من الرج ما تطلع اذا الماتيريال ما عنده الاستيسيتي، لانه راح تصير مثل الحفره. زين انا من اشيله من الحفره شنو اطلعه؟ ما تطلع، لانه هاي الرج من هون عاليه ومن هون عندي حفره هتشوف. فمن الماتيريال تبس بهاي المكان ما راح اطيق اسحبه تطلع خارج. لو عندي الاستيسيتي ماتيريال مثل ربر بيس، ايش راح تعمل؟ الماتيريال هي تنكبس وتطلع وتفتح مره ثانيه، ترجع على شكل الرج اللي مسجله. هاي اندر كات. الشغله الثانيه، ليش نحن نعمل فاينل امبريشن؟ شوف انا بالنسبه لي الفاينل امبريشن ككيميكال وكفيزيكال بروبرتيز تختلف عن الماتيريال اللي هي استخدمها بالبرايمري وبالسكندري. فالسكندري اذا تشوفهم هسه تلاحظهم بشكل عام كلهم تقريبا فلوبل ماتيريال، يعني واحد كريمي واحد تو بيست، ما ماتيريال هيفي. اوكي، هاي الماتيريال اطيق تفوت بكل مكان، لانه انا الفاينل امبريشن لازم تكون فول ديتيلز. بس المشكله وين؟ انا هسه اذا اجيب ان شاء الله بالرابع وبالخامس من تاخذون بيشنتس التري على بيشنتس، تاخذون امبريشن للدنتشرز، مرات يجيني بيشنتس يعني اجيب له التري اللي هي ريدي ميد، اوكي، كلش كبيره، يعني الريدج، خلينا نقول هذا الخط هو الريدج وهذا التري هاك مسافته كلش كبيره. زين، انا هذه اذا استخدم له فلوبل ماتيريال وين راح تروح؟ راح تمشي، ما تسجل شيء، لانه هاي من تكون ثين ماتيريال راح تعبر وتروح وما تسجل كل شيء، لانه ماكو شيء ماسكه. بينما انا اذا اخذتوها بماتيريال ثقيله شويه، يعني قويه شويه، خلينا نقول امبريشن كومباوند اللي شفته ممكن اسجل هاي العلامه وارجع على السبيشال تراي تجيني كلش تقريبا فت على هاي الرج، يعني حوالي 2 مليم او 1.5 مليم الثكنس. اوكي، بعدها ايش اطيق اعمل؟ اطيق اضيف الماتيريال مالي، لانه الماتيريال هي تتطلب مني انه 2 مليم. بعد هاي ال 2 مليم صارت عندي، لانه بالسبيشال تري راح اضمن انه كل الاناتوميكال لاند ماركس صارت التري مالتي تقريبا شبه البيس مال دينشر. فراح اخذ الامبريشن راح تكون دقيقه جدا جدا، بحيث الماتيريال تفوت باي اندر كات، تفوت باي اناتوميكال ستراكشرز، تسجل لي كل الاناتومي ستراكشر. ولهذا الماتيريال مال فاينل تختلف عن الماتيريال مال برايمري. ولهذا انه انا اعمل فاينل، يعني لازم تكون الديتيلز مالي كلش دقيقه، انه الدنشر اي بارت من المليم away from the soft tissue hard tissue راح افقد الريتنشن مالتي.